I'm Professor Rob Middleton and I'm head of the Orthopaedic Research Institute at Bournemouth University. What we can see here is the Mako robotic assisted arm and that's used for performing robotic hip replacements in patients. But the robotic arm works in a very different way from robots we normally think of. We normally think of a robot as actually doing an action or procedure or making something. And the safety feature of this is the robotic arm actually does none of the operation, but it stops the surgeon doing the wrong operation. How the Mako robot works is that we take a CT scan of the patient before the operation and then use a computer model to develop a 3D virtual image of it. And that's shown here on the screen. With that 3D image, the surgeon then can plan the perfect position for that hip replacement. And then during the operation, the surgeon is looking at this screen and making sure that he's putting the hip replacement in that planned position. What we think is going to happen is that by performing a hip replacement and putting the components in the perfect position, we're going to improve rehabilitation, function and long-term outcomes. This technology is expensive at this stage and we need to prove its value and outcomes. And I think a collaboration between the university and the hospital means that in the next year or two we'll know if this has benefits for the patient, but also overall can bring the cost down. And if that's the case, then this type of surgery should then be available to all people within a few years.